My name is Stephanie Starmer and I am a certified medical assistant here at CHAS Health. I have been a medical assistant for the last 6 years. One of the things I love about medical assisting is I get to come to work every day with the goal of helping people. I get to be a part of their care while they're in clinic and to advocate for them when they're not in clinic, when they're not here with us. I love that at CHAS we get patients from all sorts of backgrounds as well as employees, and we accept everyone. So I'm really excited about the apprenticeship program and getting to train somebody who will be able to work at the top of their scope and be very successful here at CHAS Health. At CHAS, as medical assistants, we get to do phlebotomy, we do EKGs, we do spirometry, we get to do the rooming and the vaccinations. So there's a whole gamut of things that we get to do that elsewhere we might not get to. And that's one of my favorite things about being a medical assistant here at CHAS. At CHAS, I fully get to be at the top of my scope, whereas a lot of other facilities really dwindle it down, where you can't go over the patient's medications or you don't get to do the phlebotomy. I learned these skills while I was in school, and being able to utilize them is a really important thing in my job satisfaction. And I'm excited to get to teach that to other people and allow them to have the same joy. At CHAS, we do full wraparound care. So not only are you seeing your primary care physician, you might get to see a clinical pharmacist or the nutritionist or some of our multiple different specialties that CHAS offers. You get to be part of a team. And that's one of the biggest differences here at CHAS Health. You're a part of a medical team. It's not just the group of MAs. You're with the medical assistants, you're with the providers, you're with the pharmacy. And that really allows you to learn a lot more and kind of delve into different topics that at other places you might not be able to. As a medical assistant, I believe in the right care right now. My responsibility when I am rooming the patient is not just to get their vitals and go over their meds. I also go over all of their quality metrics, which I like to refer to as preventative screenings. And by me going over those, the doctor can focus on what the patient is actually here for. So in essence, we're getting the right care right now while we have you in clinic. We're taking care of all of your needs. I think a lot of them come into it just thinking, oh, I get to bring a patient back and get their vitals, and there's so much more to it. And when you're a medical assistant, you are the liaison between the patient and the provider, and you're in charge of trying to prevent them from falling in between the cracks. Patient calls, they have a question, the doctor's busy. When it's important, you get to be the person who's like, hey, Dr. May or Dr. ABC, this is going on with this patient. What do you think we should do? That way it doesn't get forgotten about or waited, for days, because we're here advocating for them. So one of the things that makes our apprenticeship program unique is that it is approximately a 12-month program. You do 2,000 hours in clinic working with patients. And with the apprenticeship, you're on the job as you are learning your new skills as a medical assistant versus the traditional, you're in class, you're doing lectures, and then you get to go on a rotation for 6 weeks before you take your national test, and then you're out doing the job. This program really enables the medical assistant to know what their job expectations are, what their responsibilities are. It gets you really involved in knowing what is within your scope of practice versus reading a book and taking a test. You're getting to do it all. Yes, so at CHAS Health, everyone's welcome, always has been, always will be. Whether you have insurance or don't have insurance, whether it's state insurance or private insurance, we want to see you.